Hello, everyone. Welcome to this week's episode on Laid Back the Atirozenga podcast. And our topic for this week is antimicrobial resistance. And our guest for this week is Dr. Ukpai Eze, who is a senior lecturer in biomedical sciences here in the UK. Hello, Doc. Welcome to the show.
Hello. Thank you, Dr. Arinze, for inviting me for the Atirozenga podcast. I'm happy to be with you here today to discuss about antimicrobial resistance.
Thank you so much for honoring the invitation. But let me start with the first question I ask every guest on the podcast. Is this your first podcast? And what are your expectations?
Definitely, this is my first podcast because I haven't done it in the past. And my expectation today is to have a wonderful conversation with you surrounding antimicrobial resistance and the global problem it has elicited. Thank you.
Okay, that's fine. But let's just start with um explaining what we mean by antimicrobial resistance. So to the layman out there, somebody who has no scientific or the non-scientific audience, what do we mean by antimicrobial resistance?
When we talk about antimicrobial resistance, it's actually a broad term which we use to talk about substances which we use to kill those organisms that we cannot see with our naked eye. So
Yeah.
antimicrobials are the substances or chemicals which we use to treat or kill organisms that we cannot see with our naked eye, which include bacteria, viruses, and fungi. So that is a broad
Okay.
term. And when we say antimicrobial resistance, that then means that is a phenomenon whereby these bacteria or viruses or fungi are no more treated by these
Okay.
antimicrobials that they were previously susceptible to, which means these antimicrobials were used to treat these viruses or fungi or bacteria in the past, but because something have happened within these bacteria or viruses or fungi, they are now not able to be treated with these agents again, which makes it a big problem.
Interesting. So, but what actually makes these viruses, fungi, bacteria you mentioned, what makes them become resistant to the antibiotics?
Okay, one thing I'll say is this. For example, in bacteria, they could develop, there are different ways in which the antibiotics we use to treat infections caused by bacteria can actually target and kill those bacteria. Some of them is inhibiting the bacteria from actually manufacturing the cell wall, which makes them to actually live. So the cell wall makes them rigid in such a way that they can't easily be broken or disrupted. So in that case, that cell wall is what we call peptidoglycan.
Okay.
And some antibiotics like penicillins, ampicillin, amoxicillins actually target that peptidoglycan, making them to kill such bacteria, especially the bacteria we call the gram-positive bacteria, which have a lot more of the peptidoglycan layer. So
Okay.
that is an example, but some bacteria like methicillin-resistant Staphylococcus aureus have actually developed a mutation that allows them to synthesize a peptidoglycan that the enzyme they use to synthesize the peptidoglycan is actually mutated in such a way that these antibiotics we use to treat them cannot recognize that enzyme to inhibit it. So as a result of that, they become very resistant to such antibiotics, and that has made them to be a problem in treating them.
Interesting. Uh, okay, so that's interesting. I read somewhere where they said this. You've mentioned the gram-positive bacteria and the rest of them. I read somewhere where someone called them superbugs. Why are they called superbugs?
Well, superbugs is an interesting term because when we talk about superbugs, we mean that these microorganisms have become very resistant to several antibiotics. So an
Okay.
example I'm going to give here is Neisseria gonorrhea.
Okay.
Currently,
So what for the non-scientific audience? What does that particular bacteria cause?
okay, the Neisseria gonorrhea is the bacteria that causes the sexually transmitted infection that is called gonorrhea in layman's term.
Yeah.
So for this bacteria that causes gonorrhea, initially these bacteria infections caused by this bacteria or gonorrhea was treated with ceftriaxone and some other antibiotics like azithromycin. But currently, they have become resistant to penicillins, to ceftriaxone, and some of them are even becoming resistant to azithromycin, which has made it now the recommendation is now to combine two antibiotics in order to
Oh.
treat gonorrhea. So in that situation where the bacteria becomes resistant to a lot of antimicrobials that were previously being used to treat infections caused by them, then we call them superbugs.
Okay. Okay. But you did mention that now we are trying as much as possible to combine a good number of antibiotics to treat these superbugs. But won't that have any effect on the immune system of the patient?
Uh, Actually, what happens is this. We don't just go and take those antibiotics and start giving to the patients. What actually happens is there is a test which we call in science, we call it synergy testing. So we
Okay.
do that testing in the laboratory, combining two that selected two antibiotics, and that will also allow us to see whether they are actually effective when they are combined. But apart
Okay.
from combining them, they still that combination also needs to pass through the process we call clinical trials, because we also want to know that this combination is not actually toxic to those who
Yeah.
will be taking them. Like you mentioned, we don't want those who are taking them to actually have their immune system suppressed, which could potentially expose them to a more dangerous infections.
Okay.
So as a result of that, such combinations usually pass through what we call clinical trials
Yeah.
to ensure that those toxicity testing, quality assurance, the clinical value of such combination treatment is ascertained before approval is given, so that such patients taking such medication actually don't have those effects, which
Okay.
we don't want such effect to be unknown. We want to know, are those effects very adverse in such a way that if they are taking them, that could be a more potential problem than what is being treated before they are given. However, there are some antibiotics which are already known to have less toxicity. So as a result of that, they can actually be given without going to pass through the clinical trials, as I mentioned earlier on. Thank you.
Interesting. But how did we actually even get here in the first place? Because getting to the point of having to use so many antibiotics to fight these superbugs, how did we get here in the first place?
Okay, I'll say one thing I'll say is this. You know, the discovery of penicillin by Alexandra Fleming was actually something we called, well, I would say it revolutionized the treatment of infectious diseases, especially the ones caused by bacteria,
Yeah.
which made it to be called the magic bullet at the time. Antibiotics were the magic bullet at the time. But even at the early period of antibiotics discovery, Alexandra Fleming made this statement: the public will demand the drug, and then will begin an era of abuses. In such a
Okay.
case, the thoughtless person playing with penicillin treatment is morally responsible for the death of the man who finally succumbs to infection with penicillin-resistant organisms.
Okay.
So that means abuse, abuse of these antibiotics or antimicrobials can lead to the development of natural resistance
Okay.
of these antibiotics, for example. An example will be a prescription, an antibiotics prescription is given to a patient who should take that for 5 days.
Hmm.
And then they take the antibiotics prescription for 2 days and they feel better on
Yeah. Okay. Yeah.
because they feel better on, they decided, okay, there is no need taking these antibiotics for 5 days as prescribed. What happens is this: when they've taken the antibiotics for 2 days, it suppresses the growth of those bacteria causing the infection in their body, and as such, they felt better. But they haven't actually eradicated the presence of those bacteria. So what happens is there is a selective pressure. Some of those bacteria that were their growth were suppressed but were not killed regrow and become much more resistant because they have now developed a cell wall or other strategies which they want to use to stop these antibiotics to actually killing them or attacking them. So that makes
Yeah.
them becoming more resistant. So that is just one example of that.
Hmm.
And also,
Yeah.
another example I want to mention is the use of these antibiotics in animal husbandry is becoming a very big problem. Some some of those who rear animals for commercial purposes do use
Yeah.
antibiotics for as growth promoters. So as a
Yeah.
result of that, those antibiotics becomes much more common in our environment. And as a result
Okay.
of that, different bacteria living in the environment acquire resistant genes from other bacteria who may not be causing infections in humans. And as a result of that, if we get exposed to such bacteria, because they've already acquired some genes that makes them resistant, they become difficult to treat as well.
Hmm. Interesting. Um, I didn't even know people who do the animal husbandry thing actually use antibiotics for growth. Interesting. So since we already know now that antimicrobial resistance is a problem, because I read somewhere that But I'm surprised because when I was reading through it and I realized that it's an epidemic now.
Yes,
So
definitely.
why is it an urgent challenge and globally, and like let's use I know we're looking at the global context now, but let's use like an African continent. Is it an urgent challenge in Africa as well?
Well, I definitely I would say it is an urgent challenge in Africa. Let me
Okay.
give you an example. There was this review that was supported by the United for the by the government of the United Kingdom, which was chaired by Jim O'Neill to review antimicrobial resistance. And that group estimated that antimicrobial resistance is a global problem. And they put a number to the mortality associated with antimicrobial resistance in different continents. And then
Yeah.
for Europe, they estimated that 390,000 individuals died as a result of mortality associated with antimicrobial resistance. And then in North America, it was 317,000. In Latin America, it was 392,000. In Oceania, it was 22,000. In Asia, it was 4,730,000 mortality per 10,000 population. And in Africa, which is the focus of your question, it was 4,150,000 mortality per 10,000 population. So,
Wow.
so this is what was attributed to that. And that was
Hmm.
in a 2016 review. And O'Neill and his team did mention that if anything is not done, by 2050, as many as 10 million people could die each year as a result of antimicrobial resistance.
That's a lot of
That is
people.
a lot
Yeah.
of people. That is a lot of people. And another study I want to use to buttress that and bring that back to Africa as well is a study which was published by Murrell and his team. It was published in Lancet uh, in January 2022. So that their study estimated that in 2019, 4.95 million people died from illness in which bacterial antimicrobial resistance played a part. And of those number, 1.27 million deaths were actually directly associated with antimicrobial resistance. And they went further to say that this number of deaths that were associated with antimicrobial resistance was higher compared to the death that was associated with HIV, AIDS, and malaria, which makes it a big global problem. And in Africa, the number of those deaths associated with antimicrobial resistance was even highest. For example, Western Sub-Saharan Africa had the highest rate of death that was directly attributed to antimicrobial resistance at the time of this study. So that means it's much more a bigger problem in low middle income countries. Looking at the number I mentioned earlier on for Asia and Africa, you can see the number of deaths per 10,000 population associated with antimicrobial resistance is higher in Asia and Africa compared to Europe and North America. And that is understandable because in this low in Africa, for example, you
Yeah.
will see that there is not a strong regulation on the use of antibiotics. People can easily go to the pharmacy or the chemist shop and
And take
they
anything.
can buy antibiotics without prescription.
Yeah.
And that leads to abuse of these antibiotics. And this abuse leads to the development of resistance, as we talked earlier on. And it's not just about the lack of regulation. There is also insufficient facilities to actually test those who come down with infections. And as a result of that, most people resort to empirical treatments in which they just go to chemists, like I mentioned earlier, they go to chemists, they go to pharmacy and just take antibiotics to treat themselves without actually getting their samples being tested in a pathology laboratory to identify the causative bacterial agent and test a series of antibiotics to see which of those antibiotics can actually kill the bacteria.
Mm.
So ideally, that is what should be done before the medical doctor or the clinician prescribe the antibiotics to the patient. But because of these insufficient testing facilities, people resort to empirical treatment. They want to treat themselves without actually getting a diagnosis. And something I also want to mention is lack of access to newest antibiotics. There are some newest antibiotics that are much more effective in treatment of some infections. But because those newer antibiotics are expensive, they are not readily available in the
Yeah.
African region. And as a result of that, people keep prescribing or using the antibiotics that have been used for a long time, in which selective pressure for resistance may have emerged. So that also helps to contribute to resistance. And then we talk about vaccines because of because vaccines, not all the vaccines are easily available and accessible. That contributes to increase in infectious diseases within this region as well, which contributes to the burden of
Mhm.
antimicrobial resistance in these environments.
Okay. Um. Um. I'm going to deviate a little bit. All right.
That's fine.
It's because you mentioned vaccines, and you said because some vaccines are not available in these regions, so there's increase in antimicrobial resistance in these regions. Because a lot of people still believe that vaccines, actually, you have the anti-vaccine groups, people who are actually fighting it at this point. um what do you think, being a microbiologist, what do you think about vaccine? Because since you have people fighting it and telling other people not to take vaccines, that the vaccines are going to kill them, and you are saying because vaccines are not available in these regions, it's actually increasing the problem with antimicrobial resistance. What do you think about, and how to actually encourage people to take vaccines if it's good for them?
Okay. Yeah. Something I want to mention is uh, vaccines are available in this region, but what I had mentioned is most of the vaccines are not readily available.
Okay.
Aha. So So that is one thing I want to mention. Yes, the growth of the anti-vax group is becoming a global phenomenon, not just in Africa. Not just in Africa. It's
Yeah,
a
it's
global
everywhere
is
now.
a global phenomenon. And if I use the UK as an example, because the anti-vax group are saying this measles, mumps, and rubella vaccine, they say, oh, it is associated with autism. But ordinarily, research has shown that the mumps measles rubella vaccine is not associated with autism. So as a result of that, most parents in the UK are not supporting their kids or their children to actually have this MMR vaccine. As a result of that, there have been an increase in measles outbreaks in different regions in the UK recently. So that is the negative side of the anti-vax group. And then going back to the Africa scenario, talking about those who are against vaccine.
Yeah.
One thing I want to say is vaccines are safe. Vaccines save lives. Yes, the world was able to eradicate smallpox because a vaccine was available.
Mm-hmm.
And also, the world is also closer to eradicating polio because,
It's a
because
vaccine.
there is
Yeah.
a vaccine, there is polio vaccine which is highly accepted. Yes, just like every other medication that have got some adverse effect which are manageable. Some
Yeah.
vaccines can also have some effects, but those effects are usually manageable. Because one thing that happens before a vaccine is approved for use, they pass through clinical trials in which they are tested for safety, for quality assurance, for dosage use, and also for associated toxicity, either toxicity to the kidney or to the heart or to the reproductive system and other organs of the body to further understand whether that could be approved. And panels of experts usually review such clinical trials. For example, in the United States of America, you have the US Food and Drug Administration and Control that will actually have select experts that will review the result of such clinical trials before they can actually approve that for use. And they only approve that for use when they see it is safe for human use. So,
Mm.
so unfortunately, some people still feel vaccines are not safe. But
Exactly.
that
That's
is
what I'm.
very, very unfortunate. They are very safe and they save lives. And personally, I advocate for people to take vaccines
Okay.
because it can help to prevent infectious agents and also help reduce the emergence of antimicrobial resistance in terms of bacterial infections.
Okay. Um, since you've mentioned you've mentioned taking vaccines as one of the means to actually um reduce antimicrobial resistance. All right. Are there other things apart from this? Are there other things the researchers and the government are doing to address it, or are there other things you think that needs to be done?
Yes, the World Health Organization and some governments have actually, and government from different countries have actually developed a strategy in order to combat antimicrobial resistance. And I will list some of these strategies that have been put in place and then talk about a couple of them. One of such strategies is the Global Action Plan, the World Health Organization Global Action Plan. And that Global Action Plan on antimicrobial resistance have 5 cardinal focus. The first one is to improve the understanding about antimicrobial resistance and awareness among people. The second one, strengthen the overall knowledge by research and surveillance. The third one, reducing infection incidence. The fourth one, usage of antimicrobial agents have to be optimized. And then the fifth one, develop accounts of develop and account for needs of several vaccines, diagnostic tools, and interventions. So if you look at these 5 cardinal points for World Health Organization Global Action Plan on antimicrobial resistance, you can see it covers a lot of areas. For example, in the first one that talks about improve the understanding about antimicrobial resistance and awareness among people, that then brings us to what we call the antimicrobial stewardship programs. So antimicrobial stewardship programs are programs that are put in place to educate people on the best use of antibiotics and also on the best way to prevent infectious agents. Because if people don't get infected to come down with disease conditions, there wouldn't be need for them taking antibiotics.
Hmm.
And then
Okay.
that also, antimicrobial stewardship also discourages empirical treatment, which means people who come down with infections should not just go and get antibiotics to treat themselves without actually getting their samples tested in the pathology laboratory and then appropriate antibiotics identified for use in the treatment of such bacteria infections before they are actually prescribed to the patients. And then when you talk about strengthening the overall knowledge by research and surveillance, for example, some countries from time to time, for example, in the UK, from time to time, the government commissions a research group to actually review the depth of antimicrobial resistance occurring within the United Kingdom. And that is also done in several other countries. And in some situations, the World Health Organization actually funds a research globally to look at the emergence of antimicrobial resistance and what each country is actually doing to stop this. And they do that regularly. That have informed the understanding of the emergence of antimicrobial resistance, which is why the World Health Organization termed it as one of the top 10 global public health threats. So that helps in understanding that. And then when you talk about reducing infection incidents as part of the Global Action Plan on Antimicrobial Resistance, that involves environmental hygiene, personal hygiene, because when the environment, hospital environment, we keep hygienic environment, that also reduces infectious incidents from actually happening. And then we talked about optimum use of the antibiotics, which means we should not just be using antibiotics in empirical treatment, and also I mentioned in animal husbandry
Yeah.
because they contribute to antimicrobial resistance development. So when we use them optimally and at when needed, that will help. And then the last part was we talked about vaccines previously, and then that also talks about diagnostic tools, which means there is need to develop diagnostic tools that can easily help in identifying these infectious agents and also testing in the laboratory to identify the antimicrobial agents that will be suitable for treatment. So these are things that are already put in place, but just like we all know, all of this requires funding and also collaborative efforts of different governments. So, which is why you discover in some countries that have not put these strategies in place, like some countries in Africa that don't have strong regulation stopping people from buying antibiotics over the counter, that also promotes the increased antimicrobial resistance. So what I will say is this: all hands must be on deck, both in governmental organizations, non-governmental organizations, scientists, and also, in short, everyone should put their hands in place to support the judicious use of antibiotics, encouraging programs that will help to reduce antimicrobial resistance from emerging.
Okay. If everybody needs to, all, like you said, all hands need to be on deck to solve this problem. And on a personal level now, because I can I can see that this antimicrobial resistance is a problem at the global, national level, but taking it down to the personal level, like things we can actually do um individually. You've mentioned the awareness about antimicrobial resistance, but this one is the one that is actually tricky. So is it that, for example, let's say I get sick now, because it is it's commonplace for people, especially in Africa and the rest of them, yeah, they get sick and they end up asking for their doctors to give them antibiotics, or even jump their doctors to go and buy antibiotics for on their own and start treating themselves. Yeah, it, isn't that hard for a lot? Isn't that a very hard and a tough decision to make? Because a lot of people have actually conditioned their mind that, oh, I have this problem. This antibiotics can actually make it better. Or when they go to the hospital here in the UK, when they go to the hospital, they think what they have actually requires antibiotics, and the doctor is telling them, "Oh, don't worry, take vitamin C and paracetamol, you'll be fine." A lot of people get frustrated. So, at a personal level now, how do you think people can actually contribute to this antimicrobial resistance fights? If since antibiotic misuse and overuse actually contribute to this.
Okay, one thing I'm going to say, at a personal level, like you mentioned, self-medication is a big problem.
Yeah.
And what actually promotes the self-medication is lack of funding. For example, if I'm sick and I know if I go to see a doctor, especially if I'm living in any of the African countries and I'm sick, I need to go and see a doctor, that requires that I'll need to pay for the consultation. And if my samples are collected and sent to the pathology laboratory for testing, I also need to pay for the laboratory test. And when the test results are out and I'm prescribed antibiotics, I still need to go and pay to get these antibiotics. But looking at my account, I can see I'm not able to afford all of those expenses. So the only option will now be, okay, let me just go and buy antibiotics and get it. Hopefully, it stops my infection and I get well. So that is the issue. Improving the economic situation of people will help encourage them to follow the right process of seeing their doctor, ensuring that appropriate laboratory testing is done before antibiotics are prescribed. That will help. That is a personal level. So in that case, I encourage government leaders of every region to actually provide infrastructural facilities that can help improve the economic situation of their citizens so that they don't go into empirical treatment. And something else you also mentioned at individual level will be actually telling people that not all infections that are actually caused by bacteria.
Mm.
One common one we do tell them is the sore throat. When people come down with sore throat, they want to go and see their GP and get antibiotics. But some sore
Yeah.
throats are actually caused by viruses. And because we've got the immune system that can actually help combat such viral infections over time, you just need
Yeah.
1 week or 2 weeks, and our immune system will deal with that and clear that off and will get well. But unfortunately, in areas where antibiotics are easily accessible, once they come down with such sore throat that may not be caused by bacteria, they just go to the chemist or to the pharmacy and get antibiotics to take. So educating people that not all infections are caused by bacteria. Some could be caused by fungi
Yeah.
or viruses. And as a result of that, appropriate testing is very, very important in identifying the actual causative agent so that the right treatment will be given. And one funny thing is, some of these infections caused by bacteria or viruses or fungi could have similar symptoms. And when they have similar symptoms, it is difficult to actually pinpoint it is this or it is that. It's only by doing laboratory testing that one can identify the actual cause, whether it is of bacteria cause, whether it is of viral origin or a fungi. And that is something we need to educate people. They should listen to advice from their nurses, from their pharmacists, and also from their medical doctor, the doctor that treats them. They should heed to their advice, especially when they are told that a particular situation doesn't require antibiotics use. That will help curb that. And something I also do mention is what I call catching them young,
Yeah.
which means we can actually take this educational awareness to the primary schools, to the secondary schools, and to the universities, educating people on environmental hygiene, personal hygiene, good sanitation, good use of antibiotics, which could also help. And that brings me to a society, a student society, which I've actually convened in the university that I work in the United Kingdom
Yeah.
in collaboration with Antibiotics UK, a charity that is involved, in combating antibiotics resistance. And that student society is called Antimicrobial Resistance and Stewardship Student Society. And the key aim of that student society is to promote awareness within the university environment and within the community, including primary and secondary schools, to ensure people actually understand the problem of antimicrobial resistance and also understand the best ways to actually avoid this resistance from developing in the first instance. Thank you.
Okay. Mm. Interesting. So, because of time, I'm going to ask you a final question, but I'm going to link it to everything you just said now about the student organization about antimicrobial stewardship, and what he talked about environmental, making sure the environment is clean, sanitization, hand sanitization, washing of hands, and the rest of them. So, assuming, let's say now, the UK government says, "Oh, Dr. Eze, we are giving you this responsibility in the UK to lead health policy making team." All right, to actually fight antimicrobial resistance in the UK, or maybe the world at large at the global level, but you're contributing, part of the team contributing the UK United Kingdom quota, and you are asked to come up with strategies and policies to drive and enforce this fight against antimicrobial resistance. What would you do?
Oh, that is a tricky question, I would say. That is a tricky question. But
Yeah.
one thing I would say in the first instance will be to develop a policy for antimicrobial resistance and infectious disease surveillance, because we want to understand the current state of antimicrobial resistance
Yeah.
and also understand the most common agents, the most common microorganisms that are associated with such increase in resistance. And once we're able to understand that, that will be a first point of call to know, okay, these are the things we are dealing with. And
Okay.
once we understand that, another thing to do will be to look at anti anti antimicrobial use and prescription within the UK, because we also want to understand how do people actually use the antimicrobial agents, the antibiotics or antifungal or antiviral agents. Do those that receive these prescriptions actually have their samples tested in the hospital laboratory before they get the prescription? And that will help us understand whether empirical treatment is higher than the actual treatment offered as a result of testing being done in the hospital laboratory to identify the actual agent. So that is the second thing I would want to look at. And then the third one, which is the last thing I will look at, is to develop a framework of
Okay.
educational awareness about antimicrobials and antimicrobial resistance. You will understand I mentioned about catching them young.
Yeah.
So develop a programs that will be embedded within the primary school curriculum, the secondary school curriculum, and also the university curriculum, which is not just for those who are doing science or medically related courses, but it will be a more like a program embedded in every university curriculum so that students are taught and they understand what antimicrobial resistance is and how we can judiciously use antibiotics and how we can reduce and prevent infectious agents incidents. So these are the areas my policy will focus. And I do believe if well designed and implemented, it can help reduce the emergence of antimicrobial resistance and also reduce infectious disease incidents as well. Thank you.
Interesting. It sounds it sounds like you have a good plan. Because um the antimicrobial resistance, because when we talk about infections, I know I did not mention it earlier on, but HIV is a huge problem in Africa, for example. Cancer is a global problem all over the world. And people who living with these diseases are often reading with a lot of infections because of their weakened immune system. And so antimicrobial resistance is also a problem because it leads to increased death rate we also see in this individual. So I'm really happy that you have a plan to actually fight antimicrobial resistance, but we need to create more awareness because I think maybe the scientific audience already understand what antimicrobial resistance is all about, but I think we need to create more awareness for the non-scientific audience to understand that they are part of the fight against antimicrobial
Yes,
resistance. But
definitely.
yeah, but thank you so much, Dr. Eze, for your time today. I really appreciate it.
Yeah, thank you. Thank you so much, Dr. Arinze. It was good to be in the Aturozinga podcast today. And I
So,
believe we've had a wonderful conversation.
of course, so what do you think now that you've done your first podcast? What do you think about podcasting
Well, it's more like, everyday conversation.
Exactly, exactly.
Everyday
That's why,
conversation. More like you're
yeah,
discussing with a friend on
exactly.
something,
That's the theme of the
Yeah.
podcast. Yeah, that's the theme of the podcast. Laid back, and we have important conversations, but in a friendly and laid back manner.
Okay. Yeah, that is good. You are doing a wonderful job. Yeah. I've seen other of your previous podcasts, which which delves into different areas of human endeavors, and that is very,
Yeah,
very good. They are very, very educative, and
thank
also
you.
helps a lot. I do hope to find time and listen to most of them. So kudos for the good
And
job.
thank you so much. And hopefully you'll be back again so we can actually do more and more episodes. Talk about more and more topics then.
Yeah, that is good. Yeah, I look forward to that.
All right.
Okay.
Thank you
Yeah,
so much for
thank
your
you.
time.
Take care. Yeah,
All right.
bye bye.
Yeah.